How's it going, guys? Difficult question for pathology. 59-year-old woman, 2-month history, pain in her hands, rash in her legs, afebrile, no recent illnesses, unusual exposures, palpable purpura, buttocks, thighs, lower back. She's currently enrolled in the methadone program. Laboratory studies show decreased C4. What's the diagnosis? Decreased C4, some of you know, is actually pretty buzzy for cryoglobulinemia. A cryoglobulin is an immune complex that deposits at cooler temperatures to type 3 hypersensitivity. And they can deposit throughout the body, cause joint pain. They can deposit in superficial, dermal, small vessels, causing palpable purpura. And the methadone program here, that means she's Hep C or HIV positive, but presumably Hep C because cryoglobulinemia is classically caused by hepatitis C or malignancy. Okay, so we'd say this woman has cryoglobulinemia secondary to hepatitis C, and then our palpable purpura here, our skin manifestations, our choice C, correct answer, leukocytoclastic vasculitis. It's a fancy term that means immune complex deposition, type 3 hypersensitivity, causing small vessel superficial vasculitis, the palpable purpura. Okay, that's what we have here. Now, let me just chop through some of the answer choices. I'll clarify things for you. Some of you are going to be still very fucking confused. Choice A, cold agglutinin disease, also known as cold autoimmune hemolytic anemia. This is where you get IgM antibodies against RBCs, and you'll get agglutination at cooler temperatures. Okay, so a test tube being transported to the laboratory outside body temperature is going to be cooler, so you get agglutination. But they'll give you a CMV or mycoplasma infection with a positive Coombs test and a low hemoglobin. For example, 23-year-old dude, bilateral interstitial infiltrates, low-grade fever, and he's got slightly low hemoglobin, positive Coombs test. That's mycoplasma walking pneumonia causing cold agglutinins, IgM antibodies against RBCs with cold autoimmune hemolytic anemia. I've made clips on that before, okay? So that's cold agglutinin disease, but don't confuse that with cryoglobulinemia, which you said cryoglobulins are simply immune complexes that deposit at cooler temperatures, but that's due to hepatitis C or malignancy, and you'll get decreased C4 in cryoglobulinemia. So Henoch-Schölling purpura, that's pediatric. You're not going to get it in a 59-year-old. Okay, so the reason this can be confusing, Henoch-Schölling purpura is a classic tetrad of palpable purpura, IgA nephropathy, arthralgias, abdominal pain. You need not have all four. So brought on in a kid by a viral infection. So we'll say sore throat and then red urine 1 to 3 days later, that's IgA nephropathy. If you have sore throat, red urine 1 to 3 weeks later, that's PSGN, completely unrelated. But IgA nephropathy can occur standalone, just viral infection, red urine. Okay, standalone. But IgA nephropathy can also be part of the HSP constellation, where you get immune complexes depositing in the small dermal vessels, leading to leukocytoclastic vasculitis. HSP is also known as IgA vasculitis. So this is why it's a little bit difficult, is because the skin manifestations, the palpable purpura and HSP, are leukocytoclastic vasculitis. They are. But it's not our diagnosis here. But the skin manifestations in cryoglobulinemia are also leukocytoclastic vasculitis. So it's our correct answer. Okay, so, and once again, a leukocytoclastic vasculitis is just simply when we have immune complexes depositing in small superficial vessels, small vessel vasculitis, where you get palpable purpura. And it's usually viral infection, okay? HSP type stuff in kids. Serum sickness, type 3 hypersensitivity, immune complexes. This is where patient, let's say, has exposure to a drug. It can be sulfonamides frequently. It can be beta-lactams. And then 1 to 3 weeks later, it gets arthritis and a rash. It's the fact that it doesn't occur right away, the reaction, is how you know it's a serum sickness. Okay, it's 1 to 3 weeks later. If you take a sulfa drug and then literally hours later, you get an adverse reaction to it, that would be type 1, immediate, where it's IgE mediated, completely different. So SLE, just a throwaway answer choice if you're not sure what's going on. You can get decreased serum C3 in acute flares of SLE, okay? And C1q deficiency is an autosomal recessive cause of SLE, which they ask. Okay, so the malar rash and lupus, it's immune complex deposition, but it's not a leukocytoclastic vasculitis. Wrong fucking answer. You know the deal. When 2 made more content on the subscription. Appreciate your time. That's a